the President of the American Medical Association, Dr. David O. Barbe, for his address.
Madam Speaker,
Dr.
officers,
Barbe.
delegates, physician colleagues, and honored guests. I appreciate the opportunity to address you again today as your president. But before I begin, I would too like to thank all of our active duty military members, veterans, their spouses, and other family members who are with us today. Thank you so much for your service. At our annual meeting in June, you may recall that I talked about physician leadership. I talked about how we are all leaders in a variety of contexts, in our practices, in our communities, and as members of organized medicine. Our patients, our colleagues, and our communities look to us for leadership. And I challenged all of us to ask ourselves continually, what kind of individual leaders will we be? Now I'd like to take that concept a bit further and talk about what it takes to put together the team that wins. What's the formula for a winning team? A formula that keeps soldiers committed to each other and to their mission, even under enemy fire? A formula that propels companies to the top of their field and keeps them there. Think Apple, Nike, Amazon. A formula that sustains a winning sports team. Winning teams recognize that the greatest success comes not from the effort of one or more individuals, but from a team effort. One of the greatest individual talents in baseball, George Herman Babe Ruth, put it this way: the way a team plays together as a whole determines its success. You may have the greatest bunch of individual stars in the world, but if they don't play together, the club isn't worth a dime. Every member of this House of Delegates is a physician leader, and each of us is committed to the group mission of promoting the art and science of medicine and the betterment of public health. However, our success will be determined by how well we play or work together as a team to achieve our common goal. I submit to you, it is that shared purpose, that common vision, and our willingness to work together to fight aggressively for it that moves medicine forward. So the team that wins shares a common vision and works aggressively to achieve it. The AMA has worked relentlessly to win, not only for our members, but for all physicians and for our patients, achieving a direct, positive impact as we move medicine forward. When physicians ask, what has the AMA done for me lately, and they often do, I tell them plenty. And it's almost hard to know where to start. The AMA fought back against insurance mergers that would have decreased competition, would have weakened our negotiating power, and the Anthem-Cigna merger alone would have cost physicians $500 million in reduced payments every year. We won that battle. That's right. And some of our most significant wins have come through our advocacy on behalf of physicians as we transition to the new Medicare payment system, MHA Quality Payment Program. We fought for a simple way for physicians to avoid the 4% payment cut in 2019, and we won. Physicians can avoid that penalty simply by reporting one measure on one patient this year. And if by chance you have not already taken steps to avoid a penalty, I encourage you to take advantage of this option before the end of 2017. We fought for and won retroactive policy changes to align Medicare's old reporting programs with the new Mips program, helping doctors avoid millions of dollars in penalties under the prior law. And in the 2018 MACRA rule, released just last week, We fought for greater flexibility of small physician practices, and we won again, with special scoring rules and hardship exemptions, bonus points, and other provisions to level the playing field with the larger practices. And we successfully fought to postpone a mandate for physicians to upgrade their EHRs. We are working to make sure every physician in every practice setting and in every specialty is prepared to make a successful transition to MACRA QPP. We've posted multiple resources on our website, including tools, tutorials, podcasts, and education modules. And the AMA continues to fight against the burdens imposed by government and private insurers, and we're winning that battle too. We fought to allow physicians to refuse virtual credit card payments from insurers because they carry fees that reduce our reimbursements, and we won. We're fighting to reform the prior authorization process, and we're starting to see results. Some insurers are beginning to reduce or eliminate their prior authorization requirements. And we're fighting to prevent IT vendors from blocking information or making it expensive for physicians to share data. And we're making progress. We're fighting physician burnout and the time crunch by working to improve EHRs, mobile devices, and interoperability. And again, those efforts are showing signs of success. Our work to improve physician satisfaction by reducing these headaches and making the practice environment more satisfying is at the heart of the AMA's shared strategic vision. As we provide practice and payment resources, we foster lifelong professional development and improve the health of the nation. Colleagues, these are major wins for our profession, and this is the value of the AMA. In addition, we're fighting high drug prices through our Truth in RX campaign. More than 150,000 people have signed on to our online petition calling for increased drug pricing transparency. And we're now encouraged to see members of Congress also calling for transparency. So we continue to fight the great public health crisis of our time, opioid misuse and addiction. And we have not won this battle yet, but we are making progress. Opioid prescribing is decreasing in every state, and physicians are becoming better educated and better prepared to assist their patients with pain management and addiction. The opioid crisis is a public health emergency, and everyone, from state and federal government officials to insurers to physicians and others, everyone has a role to play in reversing it. Physicians must continue to lead in their own practices, and we must advocate for more resources, more treatment options, and coverage for those alternatives, better access to multimodal pain care, and to combat the stigma that often prevents our patients from seeking treatment. As you can see, we are not only advocating aggressively for physicians, but we are also advocating aggressively for our patients. And nowhere is this more evident than in the renewed debate over health system reform. From the beginning, we have fought for 9 key principles, including access, affordability, protection of the safety net programs, and other patient protections. And we've had one overarching goal in this: maintaining and expanding health care for all Americans. Throughout this debate, the AMA, give ourselves a hand. Because throughout this debate, the AMA has been a voice of reason, asking Congress to put patients before politics and urging Congress to work on bipartisan, sustainable solutions. We've worked with other well-respected advocacy organizations representing patients, hospitals, the AARP, to magnify our collective voice to maintain coverage, patient protection, and the safety net programs. In fact, the AMA has been the leading voice among nonpartisan organizations in this debate. I want you to listen to this. An analysis showed that we achieved a 48% share of voice in the media for leading the national healthcare conversation. That is more than the AARP, the American Hospital Association, and the insurance lobby put together. That's great. So far, leadership from the AMA and like-minded groups has kept Congress away from the edge of the cliff. We've kept them from passing proposals that would eliminate coverage for millions of Americans. And in addition, Medicaid's safety net and the patient protections have been preserved. Sometimes for winning teams, it is all about the defense. And while it's impossible to predict where the debate will go from here, our steadfast commitment to putting patients before politics and our unwillingness to be drawn into the partisan quagmire will continue to reassure the public that the AMA, as the House of Medicine, is a voice of reason in Washington, D.C. The team that wins also creates partnerships that make us stronger. Along with our advocacy partnerships, the AMA is working with outside organizations to strengthen and increase the momentum behind our top initiatives. Those partnerships are exponentially increasing the reach of the AMA and our ability to solve the healthcare challenges. Similarly, we know that the AMA alone cannot solve the burden of chronic disease that affects half of all American adults and consumes more than 75% of the $3 trillion we spend on healthcare in this country. But working with partners like the Centers for Disease Control and Prevention, the American Diabetes Association, and the American Heart Association, we can have a meaningful impact. Nearly 500,000 people have completed our online prediabetes screening test at doihaveprediabetes.org. And we're also pleased to report that more insurers are moving to cover the proven diabetes prevention program. And even Medicare has announced that it will begin covering the diabetes prevention program beginning next spring. And just this week, the AMA announced an expansion of our statewide prevention efforts to 8 more states in an effort to reach the more than 84 million Americans with prediabetes, most of whom do not know they even have it. AMA's prediabetes campaign has been so successful that the Improving Health Outcomes team is again working with the Ad Council and now the American Heart Association on another public awareness campaign, this time focusing on hypertension. This new campaign targets adults who have been diagnosed with high blood pressure but who are not adequately controlled. In fact, I'll be stopping back in Los Angeles on the way back from this meeting to do a series of media interviews about this campaign. If, working in partnership with our patients and outside organizations, we can slow the progress of these chronic diseases or prevent them altogether, that will be a significant victory for public health, and it will mean a much brighter future for our patients. Dr. Madera will discuss our efforts to create an innovation ecosystem for the profession, and this includes partnerships with organizations, venture capitalists, and tech developers that are bringing the physician perspective to the development of new health technologies. And I can tell you from my recent experiences speaking at the Samsung Developers Conference and at Connected Health, these industries are very eager to partner with physicians to make these products better. And as you will hear, exciting projects are underway that will transform patient care and the physician workflow, projects that would not be possible without our outside partners. Which brings me to my next point. The team that wins prepares for the future. Here at the AMA, we are not just concerned about our patients and about our professional lives. We're working hard to be sure that the physicians of the future are prepared to take care of the patients of the future. Our Accelerating Change in Medical Education, or ACE initiative, has made amazing progress in just the 4 years since its creation. From recognizing that the curriculum needed to be modernized, to the implementation of promising innovations in our 32 ACE Consortium schools, to the spread of these innovations to dozens of other schools, we're succeeding in our original goal of changing medical education. And among the most promising developments, these schools are not just focusing on helping students become excellent clinicians. They are helping them understand the health system and training them to become physician leaders and innovators. In fact, an increasing number of medical schools across the country have now incorporated the AMA's Health System Science textbook into their curriculum. Future physicians will be called on to lead in solving the challenges of healthcare in many ways. Thanks to the ACE initiative, they will have the skills they need to do that. Teams that win also prepare for the future by understanding that they need to mentor and encourage younger colleagues. In sports, we might call this developing the farm team or simply recruiting. In recent years, the AMA has made a concerted effort to recruit medical students to membership, and that has been a win-win, not just because students are joining, but because of the enthusiasm and the commitment that they're bringing with them. They're helping to shape a new, vibrant, and forward-looking AMA. Certainly, no longer your grandfather's AMA, and maybe not even your father or your mother's AMA. Medical students are asserting their perspectives, and it's having a strong impact on our policy. At our annual meeting in June, several resolutions passed the House that originated in the medical student section. Among the concerns that they've made sure we address, protecting immigrants and DACA status individuals, simplifying and improving the USMLE exams, and addressing the serious problem of burnout, depression, and suicide in medical students and residents. These medical students who are so enthusiastic about policy will one day carry the torch for this organization. And with our continued mentoring, I am confident that the AMA will be in good hands. And residents, we know you also feel the pressure and stress like never before as you face starting your career in medicine. I encourage you to stay with us as you make the transition into practice. We need you, and in turn, we have much to offer you. So I've talked about the importance of preparing for the future, partnerships that make the team stronger, and the commitment to shared goals and working aggressively to achieve those goals. There is, however, one more ingredient for a winning team, and that's enthusiastic fans. In the past few minutes, I've described just a few of the AMA's recent wins on behalf of patients and physicians. Together, we are moving medicine forward. But in the past few months, I've had the opportunity to interact with our colleagues around the country and to update them on all that the AMA is doing. In every instance, the response has been extremely positive. Members are encouraged, and many non-members tell me that they're going to join the AMA based on what the AMA is doing for them and for their patients. We need to get our message out so that more of our colleagues will know and will join us. I opened with a quote by Babe Ruth on the importance of working together as a team. He made another observation that I think is equally important. He said, "It's hard to beat a person who never gives up." Your AMA leadership will never give up in our efforts to advance our policies, achieve our common goals, and get our message out. However, as AMA leaders, we can only reach so many physicians. That's why we need your help to get the message out. Fans attract new fans, so there's a huge multiplier effect when each of us reaches out to physicians in our own circle. At our membership booth, you can find this booklet, which includes 13 examples of what the AMA has to offer physicians. And these are the kinds of proof points that I challenge each of you to share with your colleagues. Help them understand the value of today's AMA. We know that membership moves medicine. So let's help our colleagues become part of our winning team, part of our AMA. Thank you.